At Miami Designer Smiles, we enjoy treating patients that also just have general dentistry needs, and we think it's wonderful when we can offer excellent general dentistry to our patients, and bondings and fillings are often things that we do to take care of patients who have cavities or need teeth fixed on the edges of their teeth or corners of their teeth. Sometimes patients want to know what's the difference between a bonding and a filling. A bonding is a filling. Sometimes we don't distinguish that in dentistry at all, but for about 100 years or more, silver fillings have been around, and if we were in a place that we didn't have better options, then an amalgam filling would still be okay, but there's many reasons why amalgam fillings probably should be removed. One of them is that there's no glue between an amalgam and the enamel in the dentin, and so over time there will be leakage on the walls of the silver filling and the enamel in the dentin. Another thing that happens is that metal contracts and expands over time, and enamel and dentin are the hardest surfaces in the body, harder than bone, and so over time it can cause internal fractures in the tooth, which fractures in teeth are very common, but the patient usually has no symptoms with any fractures until one day when the tooth finally breaks. If the fracture goes to the side of the tooth, the patient could lose a piece of their tooth. In other cases, the fracture line goes to the nerve and the patient ends up needing a root canal and a crown. And in other cases, a fracture can progress to the roots, and therefore if it goes to the point that the roots are divided, then the patient loses the tooth. So although silver fillings can last 30 to 40 years, and oftentimes dentists will even tell their patient, don't touch them because it's not loose and it's not bothering you, but over time it is causing issues for the patient's teeth. If you want to have teeth when you're 80 or 90, you should be proactive and consider removing your silver fillings, because over time you will end up with either missing teeth, broken teeth, or root canals.